when we talk about evolution of psychoanalysis, we are looking at something which started about 125, 150 years back. We can look at 1900 as a very important year when interpretation of dreams came out. And that really caught the attention of people around the world. So from there, it's almost 122 years, and interpretation of dream itself came out after quite some time. So we can take another 20-25 years, so approximately 125 to 150 years of history of psychoanalysis. And the way it started was Freud was working with, he worked first as a neurologist and then with charcoal using hypnosis. Because hypnosis also is a very interesting area. In fact, if we look at the use of hypnosis, it goes back much before Freud. And Mesmer used it to great effect. We have heard the word mesmerization, which comes from the word mesmer, the person who used to use hypnosis to great effect. And even before Freud, although people did not coin it that way, but you cannot escape the concept of unconscious mind if you are using hypnosis. Because you are dealing with that part which is not available in the waking state. Which means there are two parts. The waking part and that part which becomes available in the trance state. So hypnosis has a much longer history than psychoanalysis. And in hypnosis, the idea of the unconscious mind is implicit. So Charcot was working with hypnosis. Then after working with Charcot for some time, Freud worked with Bleuer. And this is where the real thing started. In the sense, first they were looking at using hypnosis. And then there was a very interesting case called the case of NAO. And the case of NAO is like a very historical case in psychoanalysis. Almost the fountainhead kind of situation. In the case of NAO, the Bleuer wanted to use something, but he could not. So all he could do was to go and talk to the person. And the person reported, NAO reported, that when she was talking, it helped her to feel better. And she said, more than anything else, just the fact that she could talk her heart out gave her some relief. And she used to call it the talking cure. That I am feeling better just after talking. And after some time, Freud also started going to her and talking to her. But Freud was more focused and ambitious. So Bleuer used to do a general talk, but Freud very soon realized that if you allow her to talk more about childhood, instead of a general talk, she feels even better. And then he realized further that if she is able to talk about sexuality, she feels even more relief. So he made a surmise that something to do with childhood and something to do with sexuality was at the root of her problems. Otherwise, how can talking about it give her any relief? And this was a revelation, because till then, people believed that it was a one-way street. It was biochemistry of the mind leading to thoughts and emotions. But from thoughts and emotions, you could ever change the biochemistry, that route was never explored. It was a one-way traffic from a scientific standpoint. But just by talking or expressing feelings, how can a disease which has manifestation in the body be cured? And from this kind of explorations, Freud and Bleuer came up with this publication, Studies in Hysteria, which is the first major publication in the history of psychoanalysis. And we will read some parts of it in original. Studies on Hysteria. It's a very important study in the history of psychoanalysis. Okay. Hysteria at that point was used as a very category term. It was not one thing. So, for example, somebody had no damage to the eyes but could not see. It was called hysterical blindness. Some people had no organic defect in the hand, but the hand just would not move. The shoulder was frozen. It would be called hysterical paralysis. So anything for which there was no organic problem noticeable, but the problem was seen, was termed as a broad, under the broad heading of hysteria. And the most explicit form of it was convulsions, which was happening all over the body. The fits, as we call, the fits or convulsions. So the fits and the convulsions were the front end of the hysterical category, but broadly the word hysteria was used to denote a category of sicknesses where no organic cause could be determined. So then what happened after the founding of psychoanalysis? The psychoanalytic movement rose to great heights till about 60s, and then it plateaued and started going down. And it came to a situation where by the 80s and 90s, it was in complete decline. And some people even started talking about as though the time is gone. Right? And psychoanalysis is something which has to be relegated to history, not important anymore. And new forms of therapy which were shorter and which were more empirically rooted, like REBT and CBT, they started taking over. Why did it happen? There are many reasons for it. And one of the reasons was of narcissistic self-righteousness, that this movement became very closed and self-righteous narcissism came in. So nobody would listen to any criticism. Anything that anybody says gets dismissed. Hello? I'm already saying, oh, okay, just a moment. Oh, I forgot to send it to Keona. She's not in the group.
Yeah. I was thinking that.
Keona, can you hear me? Can you see the screen?
Yeah. Yeah, I can.
Sorry, Kyun, I forgot to send you the link.
Yeah, that's okay.
So let me just repeat what I said right now, so we are all together. Psychoanalysis started about 125 to 150 years back, and it started when Sigmund Freud was working with his senior Bleuer, and they used to use hypnosis at that point in time. And one of the cases which came up was the famous case of NAO. In this case, Bleuer was treating NAO and nothing much could be done, so he started going to her and talking to her. And she started feeling good after talking to the doctor, Dr. Bleuer. And nothing could be found, so she used to call it the talking cure. And she would say that what gives me relief is the fact that I am able to talk my heart out rather than anything else. So this started to be known as talking cure. After some time, Sigmund Freud came in and he started talking to NAO. And this became a famous case in the history of psychoanalysis. The first case almost of psychoanalysis, the case of NAO. So the case of NAO is the must read for everyone in psychoanalysis. And we will read through this case sometime in the course. Freud started talking to her, and what happened was, the more Freud talked to her, the better she felt. Second, if Freud talked to her about her childhood, she felt even better. And if the conversation went to sexuality, she felt even better. So Freud deduced two things. One, talking helps. Talking about childhood helps even more, and talking about sexuality even more. So there was something to do with childhood and sexuality related to her problems. And this was published in a paper, almost a book, called Studies in Hysteria by Freud and Bleuer. And this is a must read, and we will read through this book, some part of it at least, Studies in Hysteria. And when we say hysteria, normally we understand the fits and the convulsions as hysteria. The sickness where somebody gets the fit of the body or the convulsions of the body. But at that point, this word was used to cover a category of sicknesses where organic cause could not be found. So if, for example, your hand was okay, but you could not move your hand, it was called hysterical paralysis. If your eyes were okay, but you could not see, it was called hysterical blindness. So any problem of the body, not only convulsions and fits, but any problem where no organic cause could be found was called hysterical. So it's a category of sicknesses. And we have to remember that at that point, it was a sexually repressed society. And therefore, many people had sexual repressions far more than we have today. So we can see how culture changes the type of psychological sicknesses people have. What was the most common sickness at that point, hysteria, is today no longer even in the top 10 because the society has changed. So this is
today
how
OC is very common.
Yeah, today OC, narcissism are very common. So Kohut makes a very interesting observation on this point. He says, earlier the problems were there was a strong desire and frustration of the desire. So the sicknesses could be understood in the drive frustration model. That there was a drive and the drive was frustrated by morality or reality, and therefore the sickness. Today we have problems of object loss and object attack. So Kohut says, use these two words. He says, the tragic man and the guilty man. He says, in Freud's time, we had the guilty man. That there was a drive and there was a frustration and a minding of reality or morality. So we had the guilty man earlier. Today we have the tragic man. where sexuality is not so repressed, but people are facing early life object loss or object attack. Right? So today we have the tragic man and not the guilty man. Of course, these are not extremes. You can still have some people in the guilty condition, and even Freud would have had some people in the tragic condition, but we differentiate between the exception and the rule. Right? Kohut says today the rule is the tragic man, and earlier the rule was the guilty man. So psychological sickness also has a very strong social component to it, the cultural component. Right? As culture changes, the type of patients we get in the clinic, that also changes. And that is true even in biology. If the cleanliness changes, you don't have malaria. If the water becomes pure, you don't have so much of jaundice and typhoid. So control of environment can lead to a control of public health, not only in biological terms, but also in psychological terms. Unfortunately, we have never thought of from a public health standpoint about psychological health, because that would lead to a design of culture. And that we have not done. So that will take up some other time. But Freud published path-breaking studies in Hysteria. Then what happens to psychoanalysis? It rises to its peak till 60s and then starts falling because of narcissistic self-righteousness. We were completely closed. We would not listen to patients. We would not listen to anybody. And any objection raised was dismissed as a defense. Right? So if somebody said that, why don't we focus upon thought? We would say, oh, this is a defense against feelings. So people like cognitive therapists, they took up this thing and they said, you don't want to focus upon thought, we will focus upon thought and create a new therapy. Right? Some people said, why don't you focus on behavior? And we said, behavior is only a consequence, not the cause. Focus on the cause and the consequence will change by itself. And from behavior to thought, there is no reverse way. It's only one-way traffic. So some people took up that point which we did not address and created behavioral therapy. Okay. So for example, somebody has is washing his hands 20 times a day. A behavioral therapist would say, slowly convince him not to do it 20 times, ask him to do it 15 times. Then ask him to do it 10 times. Whenever he reduces, reward him. Whenever he exceeds, punish him. So by reward and punishment, the behavior can be modulated, and taken to the healthy state. And they also get results in many cases. It's not that they don't get results. Then people in cognitive area, they would say, let us go into the cost benefit analysis and make the person understand the cost of what he is doing, and then ask him, would you like to pay the cost? So they focused upon the thought aspect of it. And psychoanalysis took a very different stand, and we will say he is washing the hands 20 times a day because he's washing off the guilt of the Oedipal crime. So we would say at 5 years of age, he had the Oedipal fantasy, and it is the guilt of that Oedipal fantasy he is trying to wash off with his hands. The fantasy may be just the guilt of having the Oedipal desire, or the fantasy that in his unconscious mind he has actually killed his father and the blood of the father is in his hands, in a psychological sense. So it reminds me of one of the movies one of the documentaries I will recommend. It's titled Human All Too Human. And there Nietzsche talks about his famous statement, God is dead. And he says, God is dead and therefore we are free. But this freedom has a price, that we have blood of God on our hands. And who is going to redeem us of this crime of all crimes? So we'll discuss that some other day, but on those lines, the Oedipal explanation goes. So you can see how the same problem has a different understanding in behavioral therapy, cognitive therapy, and psychoanalytic psychotherapy. And because there is a difference in terms of how the sickness is generated, how it is going to be healed also is different. Because how you are going to heal is a direct function of how you think it has started in the first place. So how a sickness starts is what we call pathogenesis. And how we heal is the healing method. Healing method always is a function of pathogenesis. Yeah, Kiona, you had a question.
No. I just wanted to say that we see a similar thing in Macbeth by
Yes.
Shakespeare, where the protagonist actually murders someone and then she, or he, I'm not sure, constantly is trying to wash the blood off, even when there physically is no blood.
So my teacher actually did film analysis of Macbeth, and he did the film analysis of Macbeth based on Oedipus complex.
Oh wow, that's nice.
If we get time, we will do film analysis of Macbeth. It will be very interesting. We will take up some drama of Shakespeare, Macbeth or some other drama, and do a film analysis, applying these concepts, psychoanalytic concepts. So we were narcissistic, we were self-righteous, so we did not listen to others. That was one reason for the decline. Second was, we could not appreciate the healthy parts of the individual. Everything was pathologized. So this led to some people like Hartman, who created a work on healthy parts of our ego, that everything in the mind is not pathological, there is a healthy part of us also. So this pathologizing of everything was the second reason why the decline came. That psychoanalysis were accused of reducing everything to what happened in the mind of the infant. So reductionism was the accusation. And negativity and pathologizing of everything was second accusation. That first you reduce everything to the infant's mind. Second, you are very negative. You can't see anything positive in the human mind or the world. And we will deal with this point, that is psychoanalysis really negative? Right? In the next slide or a few slides from now, when we talk about the classical and the romantic vision of psychoanalysis. Okay. Third, the training of psychoanalysis was such that the trainees were castrated into conformity. So nobody could raise their voice, and this is true even today. The training of psychoanalysis is so castrated, right, that people are bulldozed, hammered into conformity. When in fact the training has to be such that this is a very intellectual area. Unless you bring in literature, philosophy, spirituality, the training cannot be complete. But psychoanalysis keeps a distance from all of this. And therefore, innovations in psychotherapy happened outside of psychoanalysis, in cognitive therapy, behavioral therapy, and CBT. And the worst decline was from 80 to 2005. And we can see even today, people who are trained in this era, right, they look down upon psychoanalysis. So it was reduced to like a corner cafe in this city of psychotherapy. But today, fortunately, we have a return to psychoanalysis, and more people are interested and they get into it. They see the benefits of it, and a new area where neurology comes together with psychoanalysis to explore if psychoanalytic concepts can be neurologically studied. That is bringing great hope to scientific validation of psychoanalysis. So there definitely is a return to psychoanalysis, and people who are frustrated with limitations of more superficial approaches, they are coming to psychoanalysis because of the depth. So psychoanalysis is difficult to learn, but it's a very powerful theory of the internal world. Of all the theories of the internal world that we have, this is one of the most powerful theories. This brings us to a very important point of the positive and negative outlooks in psychoanalysis. This is called the classical and the romantic vision. There is a very good research paper on this. I was not able to find it. If I find it, we will read through it. Okay. The title of the paper is the same, Classical and Romantic Vision of Psychoanalysis. I'm forgetting the author, but I'll get it. Freud and Klein and beyond, right, the traditional three in psychoanalysis, they have a more classical vision of psychoanalysis. Now, what is a classical vision? The classical vision is this. It is rooted in materialism. So the concept of soul, God, purpose of life is out of the window. It sees limitations of human potential. Unlike Indian spirituality, where we believe that a person can be completely free from desire and fear if he becomes enlightened, and that is the goal. Unlike Indian spirituality, the classical psychoanalysis does not believe that it is possible. It believes that till we live, we are all going to have some unresolved issues in the unconscious, some amount of anxiety and unfulfilled desires. There is no freedom from desire. So there is no freedom from desire, and there is no freedom therefore from frustration. And therefore, desire will lead to frustration, will lead to anger, pain and other negative effects, and we have to just deal with it. So reality acceptance is a very big area. That how do we accept this reality that we face without using the crutches of fantasy or God or the next life? Can we just accept the world as it is? Can we accept our condition that we have misery, that we are going to have misery, that there is no purpose of life other than what we give to ourselves, and there is no design or great purpose to this existence? So this kind of thinking, which is based on materialism, which rejects a purposeful design of existence, which rejects reincarnation, which rejects that human potential can go to the extent that we can be completely free from our difficulties, which rejects that there is a grand purpose to this earth and human life, which rejects that through reincarnation we develop and reach perfection, which rejects that there is a benevolent power governing this world. That is the classical version of psychoanalysis. And that is often called a very negative, materialistic and pathologizing and a very gloomy version. On the other side is the romantic vision of psychoanalysis. That life is not that we are condemned to gloom and suffering. Life is to achieve our full potential and be happy and healthy. That there are healthy parts of us far in excess of the difficult parts of us. That we are free to believe in our potential and even in afterlife and a subjective reality and spirituality. That there may be an afterlife, who knows? That maybe there is reincarnation and we are moving towards perfection. And maybe we will reach a stage where we will not be in the grip of gloom and helplessness. So this is the positive and the romantic vision of psychoanalysis. Okay. And both visions actually are belief outcomes. They are not scientific outcomes. Scientific position is we don't know. Okay. So we don't know whether the classical part is true or the romantic part is true, but depends on our nature. To believe in the romantic vision, you actually have to be in love with life. A fundamentally angry and frustrated person cannot believe in the romantic vision of psychoanalysis. If you are very fundamentally angry and sad, you will more likely go to the classical vision, the gloomy, hopeless vision of psychoanalysis. There is a philosopher called Schopenhauer. He said about life, he said, endless pain to a painful end. Endless pain to a painful end. Right? He was a pessimistic philosopher, a philosopher of pessimism. Right? And he sort of captures the spirit of the classical schools of psychoanalysis. Yeah, Kiona.
When you say if the person is fundamentally angry or frustrated, does that go back to the discussion we had about suppressed emotions in the unconscious?
Yeah.
So
True. True. Okay. Because I can see my own situation. When I was very angry, I was an atheist. And I turned a believer later on. Because of many reasons, but one of the reasons was this: I was able to handle my repressed anger and pain better. So I would also say that the belief in the classical or romantic vision is as much autobiographical as much intellectual. So there is no way we can separate our autobiographical imprints on this decision making. Our life experience guides our intellect. Our intellect is not free from our life experience on this point. So positive psychology, human potential movement, parapsychology, spirituality, they point more towards the romantic vision of psychoanalysis. Okay. So how like psychoanalysis can be used for spiritual enhancement, for fulfillment, for feeling better. So those who deal with areas of positive psychology, human potential movement, parapsychology, spirituality, they follow more the romantic vision of psychoanalysis. Within psychoanalysis, you will find Jung, Winnicott and Kohut more on the romantic side. Freud and Klein and beyond more on the classical side.
So you choose whether you are following classical or romantic based on, say, your patient and their outlook to life.
No, essentially these are your personal orientations. Because this relates to the philosophical aspect of psychoanalysis, not to the technique. Not to what you do in the therapy room. But inside your mind as a person, what do you believe in? So both of them can be making the same interventions in the therapy room. But it does make a difference. I'll come to it in a moment. I think we'll have to again go into a new session. I'll just send the link and we come back to the discussion. It's very important.